Good morning. I am Maria Jinkiti Ilagan from Pasay City General Hospital. I am going to present to you what we are doing in Pasay Gen that we consider one of our best practices. This activity was entitled MSS Community Outreach Activity, Baranggayan. The Medical Social Service is under the Ancillary Services. Our office is located at 3rd floor of Building A, while our Malasakit Center is located at 2nd floor, Building B. The rationale behind our activity is Pasay City General Hospital receives handful of complaints coming from barangay officials that were being brought to the mayor's attention. Some of the complaints were as follows. Patients were not treated promptly at the ER, mean and uncaring hospital staff, impression that healthcare is expensive and poor or sick person cannot avail medical services, and lack of awareness as to the services of the facility. The city mayor asked PCGH community to address the issue and treat all patients with compassion and understanding. PCGH team that includes the Medical Social Service tries to decrease complaints by entertaining patients accordingly. Knowing that the complaints were purely misunderstanding due to lack of information about the institution's policy and services. And we believe that it can be resolved. In our hospital, it is normal scenario that barangay captains and barangay kagawads accompanies their constituents when availing services to the facility. There were incidents that referring party got infuriated because they felt that their constituents or patients were not given priority, especially when brought at the ER. During those incidents, the medical social worker made friendly conversations, getting the opportunity to discuss programs and services of the hospital that their constituents can avail. Aside from the orientation of policies given to patients and relatives, barangay officials are being provided an orientation so that they can help the facility disseminate information among their constituents. It is affirmed to the medical social worker that some of the barangay officials are just misinformed about PCGH policies and services. Thus, there is a need to reach out to communities for enlightenment. MSS was able to conduct one barangay visit under then Barangay Captain Norman Jennings of Barangay 60 on that purpose. But since Pasay had 201 barangays, and with the present number of medical social worker, the unit realized that it will take some time and it will be more convenient to convene all barangay officials in one setting so that we can conduct sort of orientation about the operation of PCGH. The idea was given by the medical social worker to some barangay officials and look forward for the invitation during barangay assembly so as to provide health awareness to patients, their families, communities, to inculcate that prevention is better than cure, and most importantly, provide them orientation about the hospital's programs and services. While waiting for that activity to happen, MSS conducted activities that will improve services, such as program review, continuous collaboration to barangay officials, enhanced case management to patient to create impression that they are taken care of and their needs are being addressed, so that it will benefit the people we also serve. And since social media is very influential and complaints posted against PCGH calls the attention of the local chief executive, the leadership team help the facility reach out to the community by providing the logistics to hold the barangay orientation that later became PCGH Town Hall Meeting Baranggayan. So on August 8 and 9, 2022, Baranggayan was conducted. It was a 2-day, 4-session activity represented by 201 barangay captains and representative from Barangay's Committee on Health held at Cuneta Astrodome. The medical social worker, being an advocate of change, pursued the realization of the activity as part of community outreach to provide information to Pasayeños. Our objectives then, first, is to provide orientation of hospital programs and services to the community. Second, to increase community awareness with regards to hospital policy and procedures. Third, make healthcare services accessible to the community. Fourth, intensify networking system to the community or barangay officials. And fifth, decrease complaints coming from Pasayeños. The process involved receives complaints coming from the mayor's office. Our chief of hospital is the person responsible. Conduct department heads meeting to address reason of complaints. The department responsible is COH. Come up with activity that will address or answer the issue. The department responsible is PCGH team. Prepares presentation for the Baranggayan. Department responsible is the COH, Patient Care, Ancillary, and Medical Social Service. Presentation of prepared lecture to local chief executive and leadership team and chairman on Committee on Health. The department responsible is PCGH team. Issuance of memo regarding attendance to the Baranggayan to make sure that barangay captains and barangay kagawads will attend. So the department responsible is Mayor's leadership team. Invitation to DILG representative and members of the Sangguniang Panglungsod. Again, the department responsible is the Mayor's leadership team. PCGH Town Hall meeting or the Baranggayan, the department responsible is PCGH team. For the evaluation, a total of 402 barangay officials attended the said activity. During the open forum, majority of the participants appreciated the activity and verbalized that they gained information about PCGH. They have requested for more open communication with the hospital authority to reduce more misinformation. After the activity, a significant increase in the number of patients seen at PCGH outpatient department and admitted patients with proper endorsements from the barangay level and with information about PCGH policy serve as the indicator that the program is a success, aside from the fact that complaints were now minimized. This activity needs follow-through to ensure better health services to our constituents. With its success, the LGU and PCGH came up with new programs or projects that can be beneficial to the populace needing medical help, such as continue conducting information dissemination right to the community level, continue collaboration with barangay officials, promote healthy lifestyle to the members of the community, and encourage regular medical consultation and make use of community health centers. So here, I am now sharing with you some of the pictures during our Baranggayan. All our sessions were attended by our City Mayor, Committee on Health Chair, Councilor Joey Isidro Calixto, with our City Health Officer, Dr. Malu San Juan, and most importantly, the DILG representative was also present. DILG representative commends the team for coming up with such great activity, giving information and enlightening some of the barangay or constituents. Community outreach are efforts to add value to society by addressing its needs and challenges. So, thank you for this great opportunity to share. Mabuhay po tayong manggagawang panlipunan. Happy Social Work Day po.